Welcome back. We are focusing on the increase in colon cancer cases this morning with recent changes in screening guidelines that could impact your healthcare decisions. Joining us, tell us more, Dr. Eddie Castillo, director of the endoscopy lab at St. Vincent's Medical Center and the vice president of the medical staff at St. Vincent. He is also a partner at Connecticut GI. Thank you so much for joining us this morning. Cases of colon cancer are increasing here in the U.S. Do we know why that's happening?
Good morning.
Good morning.
Thank you for having me. Well, the American Cancer Society has estimated that here in the United States, we're going to have in 2025 about 108,000 new cases. Of these, about 55,000 in men and 52,000 in women. Over the past decade or couple of decades, we've been doing a good job in decreasing these cases. But over the last 10 to 15 years, we've seen an increase in colon cancer, predominantly in those patients that are under 55 years of age. We estimate that this year alone, we're going to have close to 20,000 cases of colon cancer in people under age 50. And of these, almost 3,800 deaths. We think that this increase in cases is due to many factors. Of course, dietary factors such as eating high processed foods, the sedentary lifestyle that many of us are leading, especially since the advent of COVID. And also, recent research seems to suggest that the changes in the intestinal flora, that gut bacteria that everyone's hearing about, and that sometimes the diet and the use of antibiotics and other environmental factors are definitely playing a role in this increase.
Doctor,
go ahead.
You mentioned changes in screening guidelines. What's the update there?
Well, the big update is that we lowered the age from 50 down to 45 because the rate of colon cancer in patients under 50 has doubled since the 1990s. And we know that better outcomes come with early detection. And by detecting and removing polyps early, significantly decreases the risk for advanced cancer.
Doctor, is there any particular group of people who should be screened sooner than recommended?
Yes, there are. Of course, those patients that already have a history of polyps, as well as significant familial history of polyps. For example, if you had your mother, father, brother, sister with history of colon cancer, you need to get screened, typically 10 years before that age of that family member. And of course, there are some genetic syndromes like Lynch syndrome, which is a genetic predisposition to colon cancer, and also inflammatory bowel disease. Patients who have Crohn's disease and ulcerative colitis are at increased risk. And when we talk about different populations, African Americans as well as Native Americans are at increased risk for colon cancer.
Doctor, colonoscopy is, I guess, widely considered to be the gold standard, but are there other screening options that are available and out there for people?
Yes, that's a very good question. For patients who are sort of afraid of a colonoscopy or have medical conditions that make it a bit more risky, they can undergo several stool tests, one of them being a FIT test, that's a fecal immunohistochemistry test, that checks for human blood. There's a regular just stool for blood test. And there's also the Cologuard test, which is a more advanced test looking also at DNA that could be abnormal in the stool, signifying the presence of colon cancer, and to some degree, the presence of polyps. The fecal stool tests looking for blood, we recommend every year, and the Cologuard every 3 years. There's also a CAT scan, a specialized CAT scan that can be done that's minimally invasive, and we recommend that about every 5 years.
Doctor, I was going to say, very important information. We appreciate your time this morning.
All right. Thank you very much. It was my pleasure.
Thank you so much.